I don't know. I think the funniest thing for me was when he put that all together. Like he has me doing these cartwheels on this video that talks about my loop and eye surgery and just like hilarious. It's almost just like I didn't realize this was going to be, I don't know what, like it's like worldwide now. Anyone has access to this video. Like I guess I should have probably taken a few more takes, maybe. I don't know.
Okay, good morning, everybody. I'm Polly. I'm with Vision Care Connect. And this morning in our Focus Through the Generations interview series, which is partnered and sponsored by Bruder Healthcare and Vision Care Connect, we have Dr. Himani Goyal with us. We're so happy to have you this morning.
Good morning. I'm happy to be here.
She is sort of in the middle of our generations as we're going down through the 4 actively practicing ophthalmologists in these generations, but we wanted to get a perspective from each generation while we have this unique time in our industry. So I'm going to ask you please just to introduce yourself to the audience and give just a little bit about you so that we can all get to know you.
Sure. My name's Himani Goyal. I am a cornea specialist out in Brooklyn, New York. I spend half my time teaching residents here in Brooklyn and at NYU, and half my time seeing patients. My practice is based in Brooklyn, but I enjoy both, having my own time with my patients and getting to do my thing and also just teaching.
That's great. You have a diverse position there. So you get to stay in with the residents, teaching them and learning from them too, I suspect.
Definitely.
And then applying that with your own patients. That's really nice to get to do that.
Yeah.
Well, I'm so happy to have you with us. And I'm going to start off just by asking something fun, if that's okay.
For
What
sure.
do you do outside of teaching residents and seeing patients? What do you do for fun?
So I run. I've taken up commute running ever since having kids, so it's been tough to get my workouts in, and that used to be such a big part of me. So I run. I've also gotten into breathing, and then I spend my time with my kids too. I have a 4.5-year-old and almost 6-year-old now.
Oh, fun. Okay, breathing. Explain that to me.
Yeah, so it's really interesting that you say that. I was looking over these questions and kind of preparing for this interview and thinking, what would I say? And, it changes. Like if you were to ask me maybe a year ago, it would be different compared to like, a few years ago and today. So I recently read this book called Breath by James Nestor, and it's kind of reignited this whole interest in the breath and being in the moment and like sort of part of like meditating and breathing. So I've learned over the years some breathing exercises that I think have really just kind of been a big part of getting me through the day and part of my like mental exercises and mental relaxation. So for some reason, that was one of the biggest things that came to me when I was kind of thinking about what do I do outside of ophthalmology? Actually, that's a really big part of me now. Yeah.
Wonderful, especially you have 2 small children, and then you also are a full-time ophthalmologist and you're a teacher. And so, yeah, you probably really need to have that moment.
Yeah, it's really interesting, the different things that I've kind of, learned about that. And I think, it's definitely helped me focus and kind of, be in the moment whenever it is, be focused on one thing, but be able to change the next minute if I need to.
That's really nice. It's called Breath by James Nesbitt. Did you say?
Nestor, James Nestor.
I have to look at that.
Yeah. I mean, I was introduced to a lot of it years ago through The Art of Living, but I think just revisiting and just recently listening to this book, I listened to it on Audible, and it just really like got delved deeper into it and have a whole nother understanding. Just like, I feel like it also relates to our nature in ophthalmology. Like, just like you're saying, there's so many different generations and like, we just, we learn from each other. It's such a great time to be in something like this that's like hugely dependent on technology, but also hugely dependent on its history. And so believe it or not, like the art of breathing is actually part of the same thing. There's so much history there. And then there's so much like that relates to our world now, and bringing those 2 worlds together. It's sort of a similar sort of situation where you learn from the past and the current.
And it's so true in everything we do, really. If you apply the past to the current, you usually come out with better outcomes.
Definitely. Yes, I totally agree.
Something without looking at why you're inventing it, which is where it came from, and then where it's going to go. And technology, we know, is just continuing to evolve, but it's evolving. That's the word, I think, is such a key word.
Yeah, yeah. And just kind of being okay with everything forever changing. Like that's the norm.
I like that. Well, I was the baby of five, so in my life, everything changed every day. So it still
Oh
does.
yeah.
Well, while we're on that, I'm going to ask you, who's your go-to person in the industry? Who is your go-to person for, um, you're having a problem, anything? What, maybe you don't have one, maybe you have several, but who would be your go-to?
So my mentor has actually been Douglas Lazaro has been one of my biggest mentors. He was actually our chairman at SUNY Downstate when I started my residency. Um, he took on the chairmanship as interim chair, and then he became chair, and then really just has been an amazing role model, um, and really has taught me a lot about what it is to be a mentor. Um, to really just elevate the people that you're around, and be supportive to a point where, uh how do I put it, like, he really believes in his residents, he really believes in his staff, and he's really there to create teams and elevate you. So even if there's a situation where you've made a mistake, he turns it into a learning experience instead of putting you down or any of those kinds of things, and like lifting. He has a very lifting kind of personality, and it's like it's so enlightening, to be able to be around somebody who's constantly able to do that. I mean, just sort of thinking of it as like when you're growing up and as like a student, you look up to your teachers, and then when you get into, for us, we look up to our attendings, and obviously our chairman is someone that has just that figure of someone that you really look up to, and you're kind of sometimes scared to like let them know, like, hey, I did this and this is what happened. And just the relief to have somebody that's always going to be kind of on your side and be able to like tell you, yes, like when you should learn from your experiences, but also to say like, oh, well, if you're going to have complications if you operate. The only way you're not going to have complications is if you don't operate. So just like things like that, he's really just always been there for me. And yeah, there are definitely many more. So many of my attendings that really trained me in the OR. But in terms of just being a role model and being able to teach my residents and bring them together, and really use every experience as a learning experience to elevate each other, he's been the one that really stands out.
I can see that, and it does portray in you,
Yeah.
that in listening to you, and I can almost tell that you're that kind of person that would take that moment and make it a teachable moment, because if we never make mistakes, we never learn. And I think that's one of the things that, I've learned from other ophthalmologists. And you said something that triggered something. I was in a practice once, and the patient said, have you ever had any complications? And he said, well, of course I have. He said, because I've operated enough that I have complications. He said, if someone tells you they don't, that means they never operate. So be careful.
Right. Right. Yeah. I mean, you can think about it in any aspect of life, right? Like when you make a mistake, that's like the biggest learning experience for you. And medicine is no different. So luckily we have a support network around us, to help us through every situation. But yeah, it is so true. And we all need to just be there for each other.
Well, your residents and your children both are going to benefit from that so much. And
Thank you.
letting them make their own mistakes. I was guilty of trying to protect them from making mistakes. So,
Well, it's hard not to.
but it's great that you have that. I love that. Let me ask you something, especially with residents this year and with COVID of 2020. We don't want to dwell on COVID, but I know, just like you said, there are things we learned from COVID that we may not have put in practice had we not been forced to. What are one or more of those things that you learned that you'll actually continue to do?
Yeah, so It's really interesting. I think COVID has been really different for each one of us. I mean, each country, a lot of us are in touch with each other internationally as ophthalmologists, and we kind of went through this whole pandemic and quarantine at different times very differently. Even every different part of the country went through different things. So in New York, we were hit pretty hard at the end of March and April, and a bunch of us were actually deployed. So I was actually, one of the attendings for a COVID team, and I was not practicing ophthalmology for a couple of months. And that was a huge, huge learning experience. I mean, to be able to just kind of go back and say, hey, listen, I'm going to be on a team that's, I haven't done this in 10 years, but I'm going to depend on my residents and my team who were actually in this, even the first few weeks before we were even quarantined, and learn from this. And then to switch places, and actually after kind of observing and coordinating things for this team, to be on the floors being like an intern taking care of these patients, it was such a humbling experience. And I think being in a super subspecialty like ophthalmology, but then even further in cornea, like can't even relate to my retina colleagues, much less my medicine colleagues who have, are in the ICU. But just being able to like have that experience years into practice, it really brought me back into, really, like, now that I'm back into ophthalmology and seeing these patients, just to have a better understanding for their whole life and what it means, right? Putting cataract surgery in perspective with quality of life when it comes to these major issues. So I feel like I'm very much more connected to all of my colleagues in the hospital when it comes to what we've been through, but also with my patients, and just understanding of how things are so different for my older patients versus my younger patients, and what we've been through with that. And then just on like maybe just on like a physical side, the changes that we've made and how we protect ourselves. I don't think I will ever not wear an N95 at the slit lamp anymore. So it's just one of those things. I'm like, hey, it's so interesting that ever since pandemic hit and we got our, not only did we were lucky enough that by the time, some of us from different specialties were deployed, we had our PPE, our protective personal equipment, and we knew how to use it. We didn't get sick. And being that we didn't get sick there, and then when we did eventually get back into our offices, we came in with proper PPE. Like I haven't even had a cold, and just to be like, hey, this mask, actually, this really works. And like, we're so close in proximity to our patients. I think if you look at the publications now of like the trends of the specialties that are most at risk for contacting COVID or any of these types of things, it's the specialties where we're very close up, and ophthalmology's, on that list. So just a huge learning experience, very hard to really, put into words all of it. But those would be the two major things: just the humility and ability to relate to my patients, and then to make sure that PPE is a big part of us going forward.
I like that you said that, because I'm also a believer in that. And I think about it and I think, I haven't been sick either, not all last year, and not going in, not even through the winter. And we had a pretty brutal winter here in Tennessee, as you did.
Yeah.
Really bizarre. And of course, I've not been going, out as much, but at the same time, when I do go out, I wear the mask. And I I have to say, I agree with you. I think that it's taught us to really be aware of our surroundings and aware of what we're taking in and what we're putting out. And I think that's really smart. And you were deployed. Explain that to me. Did you actually?
Oh, right. So it's actually basically an interesting way that they termed it, right? Because it's not something I normally do. They basically were trying to get, everyone that could basically help out and resource them to other things that they weren't doing. So deployment in our sense means that basically someone who doesn't do internal medicine, or they trained us for a little bit, and then they set us out to do this job. It was almost to the point where actually at NYU, they called it the COVID Army. They actually had a lot of these specialists who were not in medicine, but different specialties, who volunteered. And then, they had this whole list of volunteers and they call that the COVID Army. And then it was interesting because when I was part of the COVID Army, I was actually acting as an intern. I wasn't attending for that team. And my attending, who was a rheumatologist, I mean, she's in medicine, but also still doesn't see, patients on the floors and ICU patients. With her first comment on the first day we went to go do rounds was like, oh wow, now I know why they call it the COVID Army, because they're actually really sending you out here, um, kind of on like as a protective team, but you're not really fully prepared. Like you're prepared as much as we can, but we're here to do what we can, and learn as we go. Yeah.
Well, I congratulate you for doing that. And thank you, because there were so many people who did that. And I think it's very courageous that you did that. And I know that had to be an experience that you always remember and take with you. And I'm sure learned a lot from that. That's really interesting. I have another question for you. If you could have lunch with anyone, alive or dead or fictional, we've had some fictional people, who would it be and why?
Oh my gosh, that's a really hard question. But for some reason, Alicia Keys comes to mind. We have, I mean, I have admired her ever since. I think we're pretty much the same age. So I've known of her since I was in college, and like, she's just an amazing woman. And just her talent, her love for life. I mean, she's also a mom. She just stands for so much in such a different world in terms of like, her careers. It's so different, but I feel like she's just as passionate and has like all the other things. She's just a real person. um and I would just love to just be in her world for a little while.
Always happy.
Yeah.
I mean,
Yeah.
always happy. I love watching her because she always smiling, always happy. Her mute when she's playing, you can see that it's in her. You have a bit of that too. So she's inspired you. I can tell.
Is healing. I mean, I kind of wish I, could do that, but it's just like definitely admire that.
Well, what is the largest problem you think that is facing your generation of ophthalmology today?
I think honestly, I think it's just finding a balance of where you put technology in your life, and in our practice, and having that kind of meet our traditional ways that we were kind of taught in residency. I've been in practice now 11 years, and it's really interesting because some of the concept, phaco was already around when I was a resident, and so that was not, that was a huge change, maybe even like 5-10 years before we were in residency. But just being able to like, take all the stuff that we learned and like maybe stick to some of the basics that we learned, but build on them, and then kind of find like a balance where we're like, okay, what's okay if I don't know this exact technology. There's just so many things that you can do, but finding that balance, because there's just so much information. Like, how do you actually process all of it and like be able to use all of it? You kind of have to like pick your niche, and like, yeah, I think the biggest challenge honestly is kind of filtering out like where you really want to focus, really finding that balance, and then creating your own specialty or expertise within our own specialty. Like, even as a cornea specialist, I feel like I different from my cornea colleagues. Like, it's so, yeah. So I think the hardest part is really just finding where all of that stuff finds a balance for each one of us, and knowing that it's okay. Like, it's okay that I don't do exactly the same things, and there's going to be things that my colleagues do that I don't, and vice versa.
I like that you said that, knowing that it's okay. It's okay if I do it this way. This is my way. This is my process. This is what I'm passionate about. I like that. And what would you say to your interns in the next generation coming through? What should they be looking for when they're looking to get into a practice, or hang their own shingle out, or what is important? Just maybe 3 things that they really need to value when they look at joining something like that.
I think joining the team that they're with, regardless of location, regardless of what the practice is like in that current day, is to know that you can work with the people that you're going to join, and feel like you can be with them for a long time and build a team. It also just, one of the things I didn't know going into practice was that many people don't stay with the practice that they first join. And I think knowing that, you kind of take some of the pressure off. Like, you're not going to know everything until you actually get into it. And sometimes the things that you're looking for when you're graduating from residency or fellowship are actually different from the things that you want a few years later, or maybe several years later. And so if you can be with someone, it's very, very nerve-wracking to be out there on your own initially for most of us. And if you feel like you can actually continue this path of, right, like from med school, we're students, we're residents, we have attendings, we have our seniors, we have our fellows, we have our mentors. And then all of a sudden, hey, am I going to be by myself? That shouldn't be, right? That should be a continuation. Like the practice that you join should be, okay, these are going to be my new mentors. These are going to be my teammates. These are going to be my friends. So I think that's the priority, to be able to find a team that you will fit into. And I think that's a priority for a practice looking for a new partner too, or a new associate, for them to be able to work with this person. And that's key. And then knowing that it may not be your last place, get like just mentally kind of knowing that, hey, things can change in the future. And third, I think, yeah, being able to have independence within that group, to practice the things that you want. That's what I think, because you need space to grow, but you also kind of need someone to be there for you sometimes, to hold your hand if you need that in some moments.
I like that. That's very good advice. I just want to ask this, and I have two more questions, and I'll be done. Tell me your funniest moment in ophthalmology.
Oh gosh. Okay. So recently we were preparing for a webinar with Paul Singh and Ed Hu. And I'm sort of new to this whole thing, and so like it was a webinar on MyLoop, and Paul Singh, he's also a musician. He's just an amazing ophthalmologist, surgeon, dad, whatever. And then he's also this musician. So he's like, hey, I'm gonna put together this song, and I want to send you guys the lyrics. Just kind of do what you got to do, and just send it back to me. And I'm gonna put this together. And I'm not much of a singer, but I love to dance, and I don't know. So I and it's just we have so much on our plates. Like honestly, he's like, okay, I've got 1 hour to do whatever I can and send Paul these videos. And I went on the roof, and I just like kind of lip sang and like danced and like did some cartwheels and whatever. And I sent it. And like, I don't know, I think the funniest thing for me was when he put that all together. Like he has me doing these cartwheels on this video that talks about MyLoop and eye surgery. And just like, just hearing people's responses to that was just hilarious. It's almost just like, I didn't realize this was going to be, I don't know, like it's like worldwide now. Anyone has access to this video. Like, I guess I should have probably taken a few more takes, maybe. I don't know. But yeah, it's almost just like so embarrassing, but so funny at the same time. Like you kind of just got to own it. Can't go back now. Like,
yeah, he's such a character, and brilliant. Such a character. Everything he does has some knowledge, some humor, definitely he's got charisma. He's so cool. We're hoping to interview him as well. I just wrote to him, so you can put a bug in his ear that this was fun.
I will. You never know what he's gonna do. It's like so cool. Like you gotta have people like that in your world. Just totally functions at another level, keeps things so much fun.
He is quite a hoot. You were talking about technology and the transition, and I know phaco was a large thing. And but what do you think is the largest or the most innovative piece of technology that's come in your career, and where do you think that's going? Where do you see technology going?
It's so interesting that you bring this up, because I feel like we've actually, phaco technology's come a long way with like, now I feel like the Centurion having like a pressurized system, and not just that exact phaco machine, but a lot of them have also just really primed themselves and are like really smooth now. But I feel like we've also come to a point where we've realized that technology has its limits, and sometimes doing something manually is actually better. So I can't lay my hand on one exact technology that I love, because I think everything, even eczema or everything, all of that actually was, pretty popular when I was a fellow, and just is now just kind of, very normal. People get LASIK, all like, it's just a very normal part of life, where it was kind of um, like the new greatest new thing, but now it's very normal. And so I feel like we've found where technology is amazing, but then we've also found places where, like, it's probably not better than what we've actually trained ourselves to do, and these hands to do, and these brains to do. Femto, for example, that was actually something that became popular for cataract surgery when I was a young attending. And it was amazing. It had so, it's like, and it was like, it is a great tool, but we realized actually it doesn't really make us more efficient in every cataract, but there are certain ones that it really helps us with. Um, and then, maybe it's got a niche in astigmatism correction for the patients who have that mild astigmatism, or, just different little parts of it. And then even with phaco, I feel like we've gotten some instruments now, like the MyLoop, which actually manually divides the cataract. And it's like, oh, wait, hey, we actually have a better looking cornea the next day. And we more efficiently took out that cataract with the MyLoop, which manually divided it versus, just phacoing it. And then MIGS, I can't like that's just an amazing new innovation. It's actually been a huge part of my practice, but it's also just opened up the world of opportunities for patients, because MIGS is microinvasive glaucoma surgery is so much more approachable for many surgeons who weren't trained in glaucoma. And I think that cataract surgeons will now be able to bring it to their patients. And it's like, and it, so it's really hard to answer that question with one thing, but it kind of goes back to like, we're gonna figure out our best balances. We're gonna know, like, we're gonna know that technologies are going to have their limits, and we're going to find that balance. I think this is kind of the era that we're in.
I like that. And I like the fact that that you realized and stated, not realized because you know that, but that you stated that your hands and your brain have to work with the technology. And sometimes when the technology doesn't work, you got to depend on your hands and your brain. And I worry sometimes that the younger generations coming out are going to learn to depend more on technology. And as I talk to some of the traditionalists and the boomers, they have that same fear. It's like pilots now who can't navigate unless they have the computer. So if the computer goes down, you're in trouble. And so I think that teaching those skills, and I know that now your residents are in good hands, because you're going to make certain that you're teaching those skills and teaching them the importance of that. So
Yeah.
that's awesome that you're doing that. Um, I just have enjoyed this so much. Thank you.
Thank you.
Getting to know you through this interview has been so pleasing, and I just want you to know you're such just a warm spirit, and I think a very talented person, and I admire you, and I think the things you're going to be teaching to your residents, I know they're going to come out very well prepared. And I love the fact that you also have in mind and giving them the certainty that they have the right to choose where they want to go, and to not, like, it's not a marriage, it's not permanent. It can be, and you can work at it being, but to learn who to choose for you that best fits you, because I think that's so important. And I think that causes a lot of disturbances in practices when that's not fully discovered. So,
Definitely.
well, would you like to say anything else before we go?
Oh, this has been so amazing. Thank you so much for the opportunity. It's, I kind of have come to love actually meeting people. This is in this way. So thank you so much for making this morning such a bright morning for me.
Well, you are so welcome. Thank you.